Mateo County Sheriff's Office of Emergency Services, January 17, 2019. Madam Chair, can I have a roll call, please?
Atherton, Belmont, Brisbane, Burlingame, Colma,
Here.
Daly City,
Present.
East Palo Alto, Foster City,
Here.
Half Moon Bay, Hillsborough,
Here.
Menlo Park, Millbrae,
Here.
Pacifica,
Here.
Portola Valley,
Here.
Redwood City, San Bruno,
Here.
San Carlos,
Here.
San Mateo,
Here.
South San Francisco, Woodside, County of San Mateo.
Madam Clerk, do we have a quorum?
We do have a quorum.
Thank you, Madam Clerk. With that, I'd like 1992 Olympic gold medal winner Herb Perez to lead us in the Pledge of Allegiance.
That's a lot of pressure. Hand over your heart. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you.
You're welcome. That brings us to item 2 for the approval of minutes. Can I get a motion to approve the minutes from September 20th, 2018? All those in favor?
Aye.
Great. That brings us to item 3, Operational Area Report, Attachment A, Captain Craig Denton. But before I do that, we want to recognize someone extraordinarily special to all of us. She served on this committee for about 18 years, and that is Sue DeGree. Sue, can you please stand? Was it 19? Okay, well, either way. So on behalf of the county, we have a commendation for you just to thank you for your work. And then Craig Denton's going to present you with the San Mateo County Challenge Coin.
When you mentioned it the last time, I wanted one.
Thank you very much for all your service.
There you go. You want to say something, Sue? Sure.
I just want to thank everybody. I've enjoyed coming here. I've learned a lot, and I got a lot out of this. I will sort of miss you all. I'm glad it wasn't yesterday when it was raining, because I was thinking, oh, I don't think I want to do this. So anyway, keep up the good work. I learned a lot. It's very important. I've been listening to the governor's budget. I think our emergency services is going to do pretty good. So thank you all again.
Thank you very much, Sue.
Thank you. And you stayed in hospital, too.
Thank you. Okay, so we finished up and completed a great 2018 here in San Mateo County, and we look forward to the challenges in 2019. And on behalf of my staff, all the first responders and emergency managers throughout the county, we'd like to thank you for your continued support throughout 2019. So, as always, we have attachment A, which is in front of you, which shows the statistics for this quarter. And nothing really glaring. Everything looks status quo, so to speak, throughout all these numbers. So if anybody doesn't have any questions on that, we'll move on to the next item.
Great. Are there any questions on that? Great. That brings us to, is that old business? SMC alert. Mr.
Yes,
Denton.
SMC alert.
Yep.
I'd like to introduce Jeff Norris, one of our district coordinators and our SMC alert specialist.
Thank you very much. This year, we looked in 2018 to be able to get SMC Alert to 100,000 subscribers in San Mateo County, 100,000 opt-ins. We didn't quite meet that goal. We got to 97,541, an increase of almost 30,000 subscribers. A great deal of effort, and a lot of the people like yourselves who spoke about how important it was to their community and who got people to subscribe to the system. We had growth in all of our communities, and we greatly thank you for that assistance. So I think we can get that 2,459 people we didn't get by, maybe mid-February. At any rate, we go forward, continuing to use the SMC Alert as our primary alert and warning system for San Mateo County, and I do have some more notes for later on under new business. So if there are any questions about SMC Alert, please.
Are there any questions for Mr. Norris? Thank you very much. That brings us to item 2 under old business, elected official EOC guideline update. Captain Denton.
So the elected officials guide is in its final draft. And so we have a few more looks we're going to give it just to ensure that everything in there is as we want it. And then once we're done with that, we're going to be shooting it out to all of you. Again, like we talked about in previous meetings, that these are essentially just guidelines, and you know, take it for what it's worth. It's just, you know, if you can find a nugget in there that you like or things that you want to follow, that's fantastic. You can obviously adjust it to your individual cities and jurisdictions, but we do want to send it out there as just another tool for you to look at and take and find something in there or not. So that's where we're at on that. And I have another engagement that I'm going to have to go to, so I am going to leave the meeting. And are you next, Kevin? So I will introduce Kevin Rose, Supervising District Coordinator for OES. So thank you very much, everyone.
Okay, thank you very much. That brings us to new business, annual preparedness survey report. Mr. Rose.
Happy New Year, everyone. Good evening. I'm Kevin Rose, OES Supervisor, 8 months into the post. I'd like to welcome the new members and congratulations to you with the Executive Steering Council, and also welcome back our returning champions. New members, Emergency Services Council, just a quick explanation of you with regards to the Joint Powers Authority of the 20 cities and the counties that enter into agreement for the Office of Emergency Services. One of the things that we have towards our benefit is with your individual city emergency managers, we have the San Mateo County Emergency Managers Association, or EMMA. And the reason I bring them up is that within our JPA, every year, basically what we do is take a toll of how we are doing individually as cities and collectively along with the county towards emergency preparedness. And so under the auspices of the Emergency Managers Association with select city emergency managers in the county, they developed the annual preparedness survey. And I do want to thank the San Mateo County EMA and the planning committee under the guise of Bart Spencer and the committee members who really helped put together this survey that we had 100% response from. The survey itself is essentially broken down into 7 sections. Each of you has your city's answers, and it's a very draft version, and I'll get towards the end the reason why. It's very much hot off the presses. We just compiled all of this information to share with all of you. The 7 sections: hazard mitigation, planning, communication, emergency management operations, training and exercises, resource management, logistics, and administration. Tonight, in the interest of time, I'm just going to highlight certain questions within the survey. And again, the survey itself is a culmination basically to demonstrate not only the hard work that we've done collectively, but cities individually, as well as the work that lays out before us. So the first section, hazard mitigation. This is a demonstration of the county and cities working together. These 2 plans, the hazard mitigation and the emergency operations plans, arguably are the foundation for emergency management with regards to your cities, your jurisdictions, and the county as well. We are at 100% in essence of each city, all 20 plus the county, having both in place. This was done collaboratively and collectively with funding we were able to secure, basically to establish in 2016 a consultant that helped us develop templates that was then sent to FEMA for approval. In 2015, the emergency operations plans, all cities in the county developing this template. Now, the template itself with the contractor gives us a uniform standardized plans, but it's the work that your emergency managers do with all of your departments that basically customizes the information, so your own plan of attack in essence of going through. The next section, planning, as we continue on. The next slide, please. Thank you. Emergency operations plan, the inclusion of. So with regards to the EOP, as we have broken down here, mass care and sheltering, that one city we're going to help out with getting that incorporated. Pet and animal care, we're roughly at 50%. And the good news with regards to that is the last 2 years we've been working on mass care and sheltering at a regional level. This is something that the Bay Area Urban Area Security Initiative has tackled. It's 12 counties, basically the 9 Bay Area counties and then 3 of our Southern Peninsula counties as well, where they all come together and work with federal funding to help develop toolkits even at the regional level. So all the counties, and counties in turn with our cities, basically are able to create plans and test these types of plans. The last 2 years, The Bay Area WASI essentially focused on mass care and shelter, something I shared at the last meeting with regards to the Yellow Command exercise. And so products coming out of that is the mass care and sheltering piece, which we're almost there, and then the pet and animal care component as well. That does play a key role with regards to our health department and the Peninsula Humane Society. Those final products are coming out, and so we're going to be able to help the other cities up that number. And access and functional needs, that is something actually that is a special project that's going to be tackled this year, in essence, of UWASI, that we'll have information to share with you as well as with your city emergency managers. Section 3, communication. 3.1, the mass alert and notification. 100% all cities in the county, as Jeff alluded to, getting SMC alert up, utilized, and active within the community. Very active yesterday, as you can well imagine. And then social media, we'll get that city up there as far as inclusion of information, because that not only is a furtherance of information to share, but also a demographic aspect, reaching the younger ages, in essence, of the same information that they need as well. And then Nixle, which is the component that will integrate into SMC alert at a certain time. Some cities, very much like San Mateo, utilize this very well, in essence, of communications with the community, in addition to SMC alert. And so it's just a nod to those cities that still have their own systems that they utilize, but also 100% participation within SMC alert. Next item, active promotion of SMC alert. Again, all cities on board, including the county. Active public outreach for emergency preparedness. Those 2 cities, OES, we're going to work with you to make sure that you get up in par with that. Emergency preparedness information on your agency's website. So 3 to 4 years ago, when I actually worked with the EMS agency, still part of EMA, we actually tackled a study into all of your websites to see what type of emergency preparedness information you had, that in turn helped to contribute to what we have called smcready.org, the county's universal information of disaster preparedness for at home, within the community, and at work. All of the cities at that point did not have emergency preparedness information on your own websites, but to your own, recognizing the importance of that, about another half dozen upped their information game with regards to emergency preparedness on your own website. The last element there on this slide, crisis risk communication plan. 3/4 of the cities in the county are there. We want to get the extra quarter there as well. That number is again assigned basically not only with regards to UWASI, with all the counties that we're working with our PIOs, but also the county reaching out to the city PIOs, basically to help with regards to shared information, messaging, crisis risk communications. And that is an element that within UWASI, within all of the 12 counties, is actually continuing for 2019. So we'll be able to increase those numbers as well. Next item, emergency management operations. These are all the cities, 18 of the 21, that actively participate in WebEOC. WebEOC is basically a software system for situational awareness and also resource requesting, 2 very strong components basically for emergency management with regards to the field, up to the city, to the county, the region, and even to the state, in essence, of trying to get resources, supplies, equipment, et cetera, to help in response. So again, OES committed those 3 cities to make sure that they also participate within WebEOC. And another thing with your support that we can ask, I'll have a few asks during this presentation, is with your own cities and your own emergency managers, we're also going to work with the Emergency Managers Association to try to utilize WebEOC more often, because it's a tool with better use and utilization, helps with understanding in the training and the exercise component. So that's something that I'll talk about an exercise in fall we hope to do. That with your cities, we also hope to perhaps and inquire within you as well, ways that we could utilize WebEOC perhaps on a day-to-day basis that some cities do with regards to road closure, weekly drills of entering your city's information and tallying that, something with your emergency managers and the Emergency Managers Association that we're going to look at to help increase that utilization. The Designated Emergency Operations Center, all of you have your primary, which is fantastic, and the vast majority recognize the need for the alternate. And again, OES with those 5 cities will work with them basically to find an alternate emergency operations center to help you and your city for in times of disaster. And then the last component, while OES helps in this endeavor with regards to your community emergency response teams, this is really your city emergency managers and your CERT coordinators that have really improved upon the CERT program. And the number itself, what it doesn't demonstrate is the 4 other entities not listed, they have committed to CERT training. And for those not necessarily familiar with the Community Emergency Response Team, it's basically a training for individuals within the public, light first aid, search and rescue, ways to help the neighborhood itself kind of improve with neighbors, with light training, search and rescue, light first aid, cribbing, to essentially help the communities while first responders are prioritizing their response and devastation. And so this is, again, a nod to the cities, a lot of council members that have gone through the training or have promoted it itself, and helping the other 4 to up and hopefully reach the level of program, recognizing that training itself is an invaluable tool as it is. Including training and exercises, we now go to EOC activations and procedures. Annual tests, those 2 cities will work with them to make sure that they're incorporated as well. The next ask I have for you is 5.6. As you can see, 100% of all the cities, including the county, have participated. Multi-jurisdictional basically means the counties and the cities getting together to exercise. This was Yellow Command last year, where 17 of the 20 cities were able to do so. We would like, with your support, and again that we'll present to the Emergency Managers Association next week, is this fall, even though the regular Yellow Command exercise that UWASI holds, it's only going to be a tabletop exercise this year at the regional level. The county and the cities, we would like to have an EOC activation of all 20 cities, if possible, with the county to test Web EOC, to test situational awareness, to test resource requesting. Objectives we'll come up with basically to make sure that your EOPs are up to par, and that every 3 years, we try to at least make it every 1 to 2 years as we can. 5.7, agency staff participation, evacuation center shelter management. Again, a highlight for that one with half there is OES helping out as best as we can, but this is really a nod to the Emergency Managers Association and your emergency managers. You have a mass care committee that has been working very well in concert with 2 other folks to highlight, the American Red Cross and our own Human Services Agency, basically to have your city staff, volunteers and CERT volunteers as well, trained in essence of being able to set up a shelter, to know how to manage it with including individuals, and as we did with the Yellow Command exercise this last year, pet care to be incorporated as well. And so that is a number that, because of this committee, because of the work Human Services Agency and the Red Cross, will increase. Next one. Resource management and logistics. This is something what I want to share with you as a highlight, not just sharing all the good stuff. There's some gaps that we have, and these are 2 gaps that I want to highlight, as well as another one that isn't listed: volunteer management, donations management, and even debris management. These are 3 items that were significant gaps that we noticed as after-action reporting coming out from the 2017 wildfires and even the 2018 Paradise Fire in Butte County. That was the major challenge for the communities to tackle. Emergency Managers Association has recognized this need. This is a tough endeavor to tackle. And the Emergency Managers Association has committed in working, OES will be working with them towards volunteer management and donations management, and getting speakers and a workshop established in 2019 to basically help those in progress to increase their efforts, to those that haven't tackled this yet to try to get into that in progress state. This is a multi-year process and progress, but something that we want for the cities to continue to engage in. As far as debris management, which isn't listed, OES was fortunate enough, listening to your emergency managers, listening to the after-action reports, reading them from the fires, in order to secure funding to recreate, review, revise, and update our existing county debris management plan for 2019. After 2019, the Emergency Managers Association has submitted application funding, grant funding, basically to then, in 2020, what we hope to do is to expand upon the county, Big C County debris management plan with regards to us, to the individual cities with your own debris management plans, basically to help with regards to the clearing of streets, roads, access for evacuation, for critical resources and supplies coming in. And the reason why we're timing that one and putting focus on it is because of the fact that right now the 2-year focus for The WASI program, the 12 counties, is critical transportation that they're going to tackle for us. And the two focus under that are evacuation and then logistics, supply, and resource chain management. So we are actually getting ahead of the game. We're probably within 2 to 3 years. WASI will come back to look at debris management for us to tackle and work on. Next slide. And then this is actually a show as you demonstrate the numbers slightly increasing in the yes and in progress categories. This is what WASI can do for us and what the cities and the county do collectively together. About 3 to 4 years ago, this was the focus, points of distribution, which essentially is areas your city designates for your constituents and residents to go to obtain in a disaster whatever supplies they may need, food, water, clothing, etc. And so this is what we hope with regards to debris volunteer and whatever the other one was, I'm so sorry, donations management, to bring the numbers up to this capacity. Next slide, administration. Administration itself is basically a snapshot for your city and all the cities and the county, basically the assigned staff, the allotted time that they can designate towards this, and the greatest challenges that we face. As you can see from this, essentially a fifth of the cities basically have full-time staff dedicated to that, and thank you to those cities that have the capacity to do so. Part-time, we're at about a quarter of the staff are able to do so. Collateral duties, that's the other duties as assigned, but trust me, the emergency managers that receive these duties are dedicated towards it, and of course with your support. And the contract, of course, is something that the Office of Emergency Services has entered an agreement with certain cities to help out with. I'm not going to plug us, but we're always there for you in case you're interested in contracting with us in that manner, although your city emergency managers are doing very well and wouldn't want me to say that. So continue to the next one. The programs themselves, as you can see, they're located, for the most part, within fire, the 50% split, but law has a component to it. Public Works is very unique. Brisbane, their Public Works Department tackles it. OES contract that I referenced, and then some have incorporated within your city managers and administration. Mind you, these are the folks, the focus, that have to touch all of your departments with regards to emergency management and making sure that the plans are in place. Next slide. So this itself, we asked all of you, the cities, the city emergency managers, what is it that you really want to focus on? What is it that's you need the help with? And as we already discussed, debris, donations, and volunteer management. And I included the sheltering, mass care, and evacuation piece because that's a continuation of the 2-year process that we've already endured for 2017 and 2018. It's a continuation of the product that WASI, because of our focus on this, will be delivering that will help with the incorporation. And then, of course, the impediments to emergency management, in essence of getting the work accomplished, time, funding, staffing. It's what you hear, it's what you know. And it's also something that basically stresses the fact of OES, of the Emergency Managers Association, of the Emergency Services Council, of coming together for these types of presentations, for these types of advocacy, et cetera. And including, of course, the other ask for you is basically you have a very draft version of your city's responses. And what we're going to do, and this is sort of a proposal with Emma next week, is not only just individually what you have of where your city is at, but we want for all of the cities to share with one another where everyone is at, so you know where you are comparatively to others. And this is sort of like speak now or forever hold your peace, but we want to create a better report for you, in essence, so you know where you are, even geographically with local neighboring cities that you could partner with, of how you're doing, where you can find improvements and continuation. And so essentially, that's the report. That's what we're going to work on with your input as you can provide, and then what Emma and us will create and provide to you, hopefully within the next month or two.
Are there any questions from the members? Ms. Morgans.
So I'm gathering by your question that you're looking for us to ask questions of each other during this point, or one of the things I saw on our report from Redwood City, the question was, agency staff has participated in evacuation center/shelter management training within the last 12 months. Is there an opportunity to partner with another city?
Absolutely. Yes. So essentially, with the Human Services Agency and Red Cross, they actually have trainings where a Human Services Agency hosts and Red Cross provides, where they invite other city staff to come, or the city itself, if you'd like to host, then they are able to come to you to provide those types of services and that type of training.
Yes, Ms. Schneider.
At least in debris management, we would be partners with the cities where we share a garbage company. So for Millbrae, that would be South San Francisco and Brisbane, because there's certain structures already in place. The JPA that's Burlingame down to East Palo Alto would be another. Coastside would be a third. It's not quite that simple. But then the county overseeing for landfill capacity on stuff like that. And I would love to get into more detail for that. But, and the slides that you've got, you're going to send them to us so that,
Yes.
I know we've got the one sheet, but your slides would be very helpful.
Correct. Absolutely.
Are there any additional questions?
Supervisor.
Yes, Ms. Perez.
This may be a new guy question, I apologize. So is there a reason why CERT couldn't handle, a CERT program couldn't handle the under 6, the convergent volunteers and those two? Or is it something that requires a different skill set?
Very good question. Volunteer management, essentially there's to break it down into existing coordinated groups that work and train together, and then spontaneous unaffiliated volunteers, SUVs as they tend to be called. These are individuals that want to help, that come to the fray, that ask for assistance. However, not necessarily sure what their skills are, their talents, and if they're representing themselves in a certain capacity, things that really become almost an issue of itself, as donations management does. And so the focus with regards to volunteer management is basically creating a way and manner that the city or the county, the operational area, has sort of like a volunteer center, some type of structure or infrastructure as an organizational setting that can accept these individuals, help spread to them where they're needed, verify their skill sets that they are who they say they are, and help in any capacity. This was something actually on the health side that post 9/11 was created from the Bush administration, because a lot of people falsely representing themselves as mental health professionals showed up at New York City. And so basically what occurred was there's the development of ESAR-VIP, the Emergency System for the Advanced Registry of Volunteer Health Professionals. All 50 states have to have their own program. For the state of California, it's Disaster Healthcare Volunteers under the EMS, Emergency Medical Services Authority, and our county EMS agency that oversees that program. And basically, it's 43 licensed certification health professionals. You sign up. This system is synced into the board registries so they can verify the people are who they are, that they're licensed as they're licensed, and even levels of licensing. Do they only, like for example, a doctor, do they only have their MD? Are they able to be in a clinic, or are they able to enter the hospital setting where they can then be privileged from the hospital to serve in their manner? And so this is more the non-medical side of the volunteer headache that we're trying to capture.
Any other additional questions? And thank you very much, Mr. Rose. That brings us to item 2, N95 Mass. Do we have a representative from the Health Department and Mr. Rose?
Correct. So I'll provide the introduction on this. As you all know, Friday, November 9th, because of the Paradise Fire in Butte County, the Bay Area itself entered poor health air quality conditions. On that Friday, the county actually had a partial activation of its Emergency Operations Center of the county manager, pulling all county departments together, with, of course, this being a public health matter, health is the lead in this instance, to see what types of services needed to be continued, what services need to be pulled back, etc. After that, we then held a conference call with all cities, with the health department assisting us in this capacity, to basically provide the information that was coming from the Bay Area Air Quality Management District, in essence of what was occurring within our area. Poor health quality falls under the health department, our health officer, and based upon our response and interest, Councilman Sylvester provide very important questions to our Office of Emergency Services, basically inquiring about air quality, inquiring about the utilization of masks, the variations of surgical versus N95 masks, whether or not to provide to the public, is there a need for an allocation, is there a need for a resource, a warehouse of these types of services, et cetera. So yes, we have the experts, and I am right now going to be turning it over and introducing you to Nancy LaPaula, who is the Administrator and Director of the Emergency Medical Services Agency, and also our Medical Health Operational Area Coordinator, and my former boss. So, Nancy LaPaula, please.
Good evening. Thank you for having me tonight to kind of discuss issues around distribution of N95 masks. And thanks, Kevin, for the introduction and the explanation of the activities that we did take under consideration and conversation about how we could support all of you and your desire to meet your community's needs and to serve your community. Unfortunately, N95 respirators are not ideal for lay individuals or for the general public because they actually can cause more harm than good. And many of you may have seen individuals in town running around with surgical masks, bandanas, and or N95 masks. But unfortunately, these respirators need to be properly fitted. You need to have a health screening to see if you are capable of functioning with an N95 respirator on. And the general population, if they wear them inappropriately, actually may cause more damage because they have a false sense of protection that they may not have. So the recommendations that Dr. Scott Morrow, who's our health officer, provided during those conversations is really based on the California Public Health Department and the Environmental Protection Agency. And so the recommendations are for the general population is to stay inside, to limit outdoor activity, and to recycle air in your car and in your home or in office buildings when appropriate. Again, the dangers to N95 masks for certain people with lung conditions or heart conditions can really lead to increased heart rate, respiratory rate. It's really difficult to breathe. If any of you have ever had an N95 respirator on, it's challenging to continue to breathe. CO2 buildup in the microambient air inside that mask can be challenging. And as I mentioned before, the bandanas and surgical masks really aren't providing the protection from the particulates in the air caused by wildland fires. So again, wearing a mask that's ill-fitting is worse than not wearing anything because it gives you that false sense of protection. For individuals that have health conditions, they really should be working, again, even more important that they stay inside and avoid physical activity outside. That they can have an elevated health risk because of the particulates in the air. If they have asthma, respiratory issues, heart disease, COPD, those things can become exacerbated as a result of poor air quality. So again, the recommendation from the California Department of Public Health and our local health officer and the Bay Area health officers all recommend that they stay inside or they work specifically with their physician for recommendations on the right course of action for them. For field workers that need to be outside and work in these smoky conditions, then they should already have protection and be fit tested, and they should follow their occupational health recommendations or OSHA standards for that. So those are the recommendations. I know it's not what we want. We want to be able to serve our community. We want to hand out masks. You see that happening in other areas. It is not the recommendation, and just for the reasons that I stated, because it gives a false sense of security.
Got it. Thank you. Thank you very much. First of all, let me just make a couple comments and then sort of just express to you sort of my thoughts on what was said. So as many of you know, I sit on the Bay Area Air Quality Management District. When we had the incidents up in Sonoma, in North Bay, and then with Paradise, the district immediately distributed N95 masks. I was in contact with at the time it was Mayor Manalo, Council Member Sylvester, and so they were distributing those masks at a very, very high quantity. So what you're telling me, it's sort of surprising to me. And so I think what I got out of your comments is that the N95 masks they provide no benefit, or do they provide no benefit if not fitted well? Ms. LaPola?
They provide no benefit if not fitted well and can cause harm if worn inappropriately by individuals that have health conditions that it would cause more harm than good.
Okay, but if fitted well, is it a good tool? Is it a good tool to have? I know ideally you want to stay indoors. That makes sense. And I know there's some talk on a state level. I sit on the legislative committee for the Bay Area Air Quality Management District about looking at cooling centers and doing all that sort of thing. All the healthcare district, no, excuse me, the health county health. They're having that discussion. So what is the benefit of an N95 mask, and why would the Bay Area Air Quality Management District distribute those masks?
I can't answer why they were distributing those masks. I can only answer to you what is the recommendation of the California Department of Public Health and the Environmental Protection Agency and our own local health officer. Its recommendations is that it is difficult for individuals that aren't used to working with a N95 respirator because it is challenging to breathe continually and to function with that respirator on. That's why when we have individuals in healthcare environments and others that are using those masks, we have procedures and processes that we monitor and make sure that everything is okay with the use of those masks. So that is the recommendation, that people will most likely, individuals, not wear them properly and be tempted to take them off or loosen them because it's uncomfortable to wear them for long periods of time.
Okay, Mr. Sylvester.
Thank you so much for your report. Do you have any stats that you can show us documenting that ill-fitting masks may cause more damage than good?
Well, I can only go with the recommendation of the California Department of Public Health. I don't have any stats personally here to share with you tonight on that. It's based on research that they have conducted in the Environmental Protection Agency.
Okay, thank you.
And as healthcare professionals, we do require specific testing and fitting ongoing to ensure that those masks are fitted properly with changes of weight gain, hair, facial hair. So it really is critical that they're on appropriately.
And you also made mention about field workers, like, say, public works. And if you have a field worker that's, say, for instance, asthmatic, would it be incumbent upon the cities to know all of their workers that may have health problems, and instead of saying, don't go to work today, stay inside, because it was the recommendation of the health department?
So I'm not here to answer an individual concern about an individual worker and the recommendations. I would go with the cities and your occupational health and OSHA requirements for that individual.
Okay. I would appreciate if I can get further information as to an update as to how you can document what you provided for us today, because if you ask me, it sounds very subjective. And unless I see something, I'm still wanting to make sure that a quick 2-minute presentation on how to fit the mask and put them on, and in addition to stay inside if you can, it's this information we can provide to our communities. Thank you so much.
Sure.
So, there are always alternate ways to get to the same goal. So it would sound like this would have to be a tiered approach in the way of preferred outcomes. And what I mean by that is it would seem to be better. I have used an N95 because I was one of those people who went out and bought them and did whatever I could do to them. And the fitting of them, I understand, is problematic. But in essence, to fit it correctly, it's about putting it around your face correctly and then adjusting the nose guard. And I have a prominent, beautiful Polish Puerto Rican nose that requires a very definite type of fitting. And actually, it gets me in a lot of trouble in council meetings, but because I'm always sticking in places where I shouldn't. But all jokes aside, I think that might make some sense to consider a tiered approach, which would be education, certainly internet web-based, on how to fit it correctly to the best of our ability. Because people are going to go outside regardless, and they're going to wear masks regardless. So it's incumbent upon us to do our best. And I'd be interested in that information. I don't disagree with you and your outcomes. I'm just curious whether we can find a better and more appropriate way, not a more appropriate, a more effective way to get people that are using the mask and have no choice but to go outside. The casual person like me who wanted to go outside and ride my bicycle on the beautiful levees provided by our supervisors, that's a different question. That's my choice. But the people that have no choice but to be outside, helping them to understand how to use the mask, I think. So that I would be interested in that information. I know it may not be your area or purview, but I think that would be helpful because people are going to go outside. They're going to use the mask. And if we provide them with the mask because we want to, then we should do our best to inform them the best way. And that's not to say that what you're saying is untrue. I know what you're saying to be true. But I think we're going to have to face the reality people are going to use them.
Well, and there are web sites that show how to and you probably have found them and seen them. The issue is that the health officer recommending that, or it's becoming seemingly a recommendation, because it is challenging to get them on right. And we actually go through testing and securing to make sure that you can't smell or there's no powder scent. So when you really fit it right, there's a real procedure that goes with it, in addition to just putting it on and making sure it's a tight fit.
Our CERT training class is starting on Tuesday, and I've been fitted for many other masks. I'm sure the first responders here are all fitted. It's not, it takes some practice, but it sounds to me like I'm going to go back to my CERT and recommend that we add a small unit on how to fit these masks. We have our own video NGO that can easily come up with a training program for this. But it sounds like I also need, and I think this is what Mr. Silvestri was saying, do we need to go back to our staff and say that any of our staff that work in the field should be having training now, or at least until the next fire season starts? Are you ready to make that recommendation?
I'm not going to make, I don't think it's my position to make that recommendation to you on how you internalize within the cities to work with your staff. I would look at your occupational health for those field workers and get guidance from them and OSHA.
Okay, thank you. I will be going back to my city manager and saying this is something we should definitely be looking at. Final question. Once the smoke went away, is it too soon to get the data of how many people have had respiratory issues post the fire in our area?
We do look at increase in emergency department. We don't have stats specifically. We looked at respiratory increase in general. So I'll work with our epidemiology department and see if they have any specific stats that are local that I can share with you.
I'd be curious. My mom has COPD, so we ran a HEPA filter. We did all of that. But I caught a cold on December 1st, and it's 6 weeks now, and I'm still fighting it. And that's unusual. So I'm kind of curious, what are the other effects for that? And I know that it takes a long time and a lot of data to see a strain, or
We can look
a
at
cause and effect on something
Yeah.
like that. But I'd be really curious.
Okay.
Thank you.
Happy to share that.
Mr. Sylvester.
Thank you, Mr. Chair. This is basically a comment. Out on the tables earlier today, there's two graphs that was provided to everyone, presented by the Air Quality Management and Water District. I'd like to commend the chair, Supervisor Canepa, and Honorable Doug Kim for making this information available to us. We don't anticipate any fires to happen, but unfortunately, it did. And up north, where we felt it much more so, I'd like to say thank you, Mr. Canepa, for assisting the folks up north with providing masks from the Bay Area Quality Management District. Basically, when I brought this matter attention and before this board, I felt it was better to have and not need. And we don't know. And we're surrounded by these many areas of forestry, to include on the southern end, Santa Cruz County. God forbid anything happening like this again, but I think we should err on the side of caution and at least have these items available to us. As my colleague of Foster City made mention, definitely would like to see a tiered approach, and maybe in our CERT training to start teach one, train one, teach one, and basically we can all help each other. So, and the cost is very, very minimal, and you know, there's other intricacies. I don't know why I tried to use that word, but I think it's a good thing. So thank you, Supervisor Canada, for your work in assisting us up in North, and to the Honorable Doug Kim for putting out this information and making it available to us as to the air quality these past few months as a result of the fires.
Great, thank you. Are there any other questions? Ms. LaPola, a quick question for you. So the county controls inventory. Do we control inventory of N95 masks? And were those masks were distributed, correct?
No,
They were not.
they were not.
So for those people who work in public works, for those people who work out in the field for the County of San Mateo, what were they instructed? So we did not issue that. We did not issue the masks.
We did not issue the masks. These masks are cash for medical emergency, for our healthcare workforce, for communicable disease or pandemic.
Okay. So when we had that air quality that was pretty miserable, what did we do for the people who? What did we do for our workers who worked outside? Were they? What happened?
So the workers that work outside would follow their normal requirements for through their supervisory process and work through whatever their occupational health through their work process provided to them. If they've already been fit tested, then they would use their equipment that was provided through that process.
And what's the equipment? What's the alternative to the N95 mask? In that case, you said they have
Well,
other.
it depends on what their job is and what tasks they're doing, and if they have the ability to not provide those functions outside during hazardous air conditions or not, or if they can look at alternative work processes. So for the health department, for those field workers that we have that go in the car and outside, we limited their need to provide those services if at all possible, to do alternative work accommodations when we could.
Okay, and so I'm a little confused here. So the health workers did have N95 masks. Is that?
If there were people, not general field workers, social workers that were going and visiting in-home support services, those kinds of things, no.
Okay, so tell me who had the masks?
Nobody, we didn't distribute any health masks, any N95 respirators to any workers in the health system that were going out into the field to do home site visits. They would follow normal processes or try to condense and do closer routes together. We were looking at alternative ways to minimize their exposure. But an N95 is not appropriate to be driving around a car in an N95 respirator. Walking from a home from the car into the home, short distance, is just to minimize that.
Okay, all right. Are there any additional questions?
Through the chair.
Yes, Mr. Reed.
Really quick, and I appreciate some of my colleagues' comments, Foster City and Daly City. In sitting up here, understand that, before we were reported about they want to have guidelines, some suggestions and guidelines for electeds in situations. But in here, I'm not really feeling comfortable or confident that there's a collaborative effort within that to give updates and some tiered service or educational elements to our communities. I understand you can't take the position about what every city does, but if it reaches to a plateau that the county is having concerns with the air quality, I think then cities should be notified. I think that there should be some protocol, there should be some process. I'd rather have us work on that than I would the elected guidelines, to be honest. And I think it's an issue that we've had and we addressed. I went up north because of a family matter, because of the fire, and I was in Red Bluff, and I will tell you that the air there was better than it was here when I left the Bay Area on that particular day. And that was some time ago after the fire. But I think this is something that we need to be, I think it was my friend from Daly City, it's about being prepared. It's about having that opportunity and option. I was always taught, and I used CPR to assist somebody years ago when you used to have 2-person. And when they came back to survey me to see how I did, I wasn't perfect, but their point was it was better that you did something and you tried to sustain that person's life, who she did live, rather than not do it because you weren't sure about how it would go, how it would work. So to me, even if the mask isn't on perfectly, with modern technology and today and what's available, I think people can be fitted to try to bring them some more assurance, which I know is a concern, but at some point we have to have something available and some guidelines from our county to our communities and to its residents on how we're going to provide something, because it can happen again. We've already seen it happen. So let's not be, excuse me, I just would prefer us not to be foolish and say, well, hopefully we never experience that again. And so that's my comments.
And I would agree that we need to be collaborative in our approach. And I believe that we were through our communication strategies. We were working with our communication, with the county's communication, with our health department communication teams to craft messaging that could go out to the public around the messaging around what to do, how to stay home, how to protect yourself based on the air quality. Those were the messages that the county, based on the state public health department guidelines, the Bay Area health officers guidelines, and the recommendations of the county's health officer, those messages were crafted and shared through the communication channels that we have in the county in a collaborative way. Thanks.
You know, I think this, and I don't know how Mr. Sylvester thinks about this, or Ms. Schneider or Mr. Medina. I do think we need to create a subcommittee of a couple members just to really engage on this issue with the Department of Health. The information you shared with us is new information to me. So I do think that warrants us, Mr. Rose, to really sort of sit down. You know, I think you alluded to it about, you know, maybe a 3-minute, 4-minute presentation, really just to be really thoughtful and for us to be educated more. So I don't know if there are a couple members that would like to be on this subcommittee, but or maybe it's at the discretion of the board. You know, I don't know, Ms. Schneider, if you think that's a good idea. If you would, Mr. Sylvester, maybe Mr. Medina are part of the board, so we could really just sort of understand this.
Happy to.
County Health would be happy to participate in it.
I'd be happy to.
I would too, as well.
Great. So we have Ms. Schneider. Yeah, Ms. Schneider.
Just a question. Several of us up here also serve on Airport Noise Roundtable. We've recently started a ground-based noise, and one of the things we've learned is that the sound monitoring devices only measure a certain type of sound, not what affects my community, Burlingame, and a couple of the others. So we're looking at that. Do we actually have the right monitoring devices that can tell the particulate matters from, say, San Bruno, Millbrae, Daly City, where I'll tell you the fire a year ago, I smelled it in my house before the firefighters, I actually called the firefighters to my house, and they came in and they said, we can't smell it. We can't find a fire, but we smell it. Mm-hmm. And then they sent out the alarms. I think that was the Lake County fire. So I think another question for us to think about is, do we have the right monitoring devices at the right place to pick up the problems? And I'm assuming right now we're talking predominantly particulate matter, but it could be other chemicals in there. And so I would just add that to the mix, because clearly with SFO noise, we don't have the right monitors in the right place. Thank you.
Mr. Chair, does that need a motion, or is that by consensus of the council that there be a subcommittee?
Is there anyone in disagreement? Through the clerk, I don't think I need to make a motion, right? It's just provide direction. So just to state the direction, we're going to appoint Mr. Sylvester, Mr. Medina, and Ms. Schneider to the N95 Mass Subcommittee to work with health. And then please use the Bay Area Air Quality Management District as a resource as well. So thank you very much, Ms. LaPaula.
Thank you.
That brings us to item 3, SB 821, hearing and discussion. Mr. Norris.
So good evening again. So a lot of numbers, but what it really amounts to is early in November, under the guidance and at the with Supervisor Canepa and Supervisor Horsley, this county put forth a resolution to direct the Office of Emergency Services, to go forth and to work as best we can with the elements of the Senate Bill 821. So Senate Bill 821 provides us with the opportunity for the purposes of emergency alert and warning to go to certain types of utility providers and to seek additional information that can fill in the holes in our reverse 911 systems. Our ability to notify by basically drawing on a geotarget on the map. This is part of the SMC alert. We have a great luxury in this county in that with the cooperation and help of Sam Bruno and Sam Bruno's fire chief, we started to work on how we can pilot this program using San Bruno Cable, a city-owned function that is a voice-over IP phone provider. So they have physical location where they have cable service to, and they know what those phone numbers are. So we can contact those houses that right now are in a reverse 911 void zone. We have no data for them otherwise. So we're going to fill in some holes. And with the help of San Bruno's chief, we've really made some strides forward on being able to get San Bruno Cable to provide us with some data. We're working on how we can template the data so we can do this. And we're not alone in this. 9 of the 12 Bay counties are using the same software. And we're a collective partnership. Right now, my counterpart in Marin is working on how to get Comcast voice over IP data into the system. My counterpart in Monterey is working on how to get water department data. So we looked at other utilities that are covered under under Senate Bill 821, and we looked at what our service providers are, including Recology, our solid waste management. They have physical locations and they have ways of contacting those customers. We looked at our water service providers, which are largely, for the most part, they are city-owned, operated utilities, but in some cases they are, such as California Water, where they work entire sections of the county. But then came our big win, Peninsula Clean Energy, an electric utility provider which is a partner of San Mateo County and who has wires going to houses and knows how to contact those people. And as we can figure out how to get their data into a more robust reverse 911 system, we can contact people who have gone away from traditional wireline phones or have gone voice over IP or have gone to cellular only contacts. So later in November, at a joint Senate hearing hosted by Senator Hannah Beth Jackson, I was invited to come down to Carpinteria and spoke to a joint legislative panel on what was part of SB 821 and how it would be used going forward. And there were some great concepts there, and I was working with my counterparts from Southern California, and we spoke to the fact that this is an enhancement of our reverse 911 system. It doesn't replace our opt-in system. It's not flawless because we have, in some cases, a residential building that's a 100-unit building that has a single power drop, which could be a management unit that isn't even in California that they have the phone number for. So we have to take a multi-tiered approach. We looked at many of the elements that go into it. This was a session that was supposed to last from 9 o'clock until noon, and at 1:30 they started wrapping it up because they realized there were more questions than answers. But we had a couple of immediate successes out of it. They said, what can we do to help you? What can we do to make this go forward effectively? And we said, you know, your definitions of utility providers are fantastic, but we need to go further. We need to be able to reach those cable TV provided IP telephones. We need to be able to reach other ways of contacting individuals. And just a few days after that legislative hearing, the 2019 Senate Bill 46 was issued, which incorporates all of the recommendations that we asked for at that meeting. So it was a fantastic opportunity, joint legislative hearing. They listened to experts in the field my counterparts from Santa Barbara, from San Diego, myself, and drew great conclusions. We look forward to utilizing these functions going forward, especially once we have our pilot program with San Bruno Cable taken care of. That will give us a jump start, and then we'll be able to start going to our larger data sets. And if there are any other questions, I'd be more than happy.
Are there any questions? Can you, for the newer members, can you talk about, why the emergency notification on a grand scale is important? Because even when you had referenced earlier the growth, I think we're at 98,000 and we're soon to hit 100,000. What Hannah Jackson's legislation does, that allows us to scale at a larger number, right? And get people to sort of, rather than sort of opting in, they would have to opt out. Is that right, Jeff?
Yes. So, as written, the way California law is worked, reverse 911 is an opt-out type of function. Your data, if it is in the telephone services, is basically importable into a reverse 911 system, and it's after you've received a call the option to opt out of it. That was great for when there was a wireline phone going to every house in the county. We imported, when we migrated to our current software about 4 years ago, we brought in about 607,000 landline telephones. And we've recently done some updates on that data, and it's under 400,000. These are the telephones that used to go to residences that just aren't copper pairs any longer. They're not traditional, what we call POTS lines, plain old telephone service. They've gone away, and they've been replaced by these new greater technologies. So how do we capture those new technologies? Well, opting in is always going to be our best strategy, because this is the information that the person will provide us. We're going to get multiple means of getting in touch with them, different email addresses, phone numbers, cell phones, potentially a work number. But that doesn't cover every structure. That doesn't cover every residence. When you have a large-scale fire or any type of incident that prompts a large evacuation, if we can't inform you, if we can't reach you, we can't inform you. And this has been heard time and time again, where people say, gee, why didn't I get informed that there was an emergency in my community? Well, the better our data set is, the more sources we can get. If I were to open the map of San Mateo County in SMC Alert and see a spot indicating that we have data on every structure in that map, I would be very happy. We don't have that now. We have about a third of them. So how do we get to that other 2/3 of people? And this legislation allows us to reach into other data sources so we can fill in more of those structures that we don't have a spot on the map for.
Are there any questions, Mrs. Chwang?
Thank you, Jeff, for your presentation. Just for clarification, you currently have a pilot program that you'll be working with San Bruno Cable to start reverse 911 and capture all the numbers going to the physical address. Is that what you're saying?
Right, that's our objective. And if you know of other city-owned internet protocol telephone services, we'd be more than happy to include them in that pilot as well. The more data we can put in that pilot, the more we can be sure it's going to work when we start going after our really large data sets, like Comcast, Recology, and our real win, Peninsula Clean Energy.
Right, and then the SB 46 allows you the opportunity to capture that larger audience. Is that what you're saying?
It changes the definitions of the type of utilities that it tells us to go and speak to. The type of utilities who will be required to at least entertain going into an agreement with us to provide data. It expands the type of utilities.
So, if I may, one of the if you are capturing the numbers through Recology, PCE, the water services in the local cities. How do you address the redundancy?
I got software for that. I, my software, the software that we're using, but the same software that 9 counties are using, has built into it the ability to deduplicate data. And it has algorithms in it that looks for matching addresses, it looks for matching numbers, and it only originates one message per number. You could put the same phone number into the system 1,500 times. It's only going to make one call to that number. So that's addressed in the software. And to that 1,500, why did I pull that number out of the air? That resolution that Supervisor Canepa and Supervisor Horsley put forward for us, in less than 72 hours after that resolution, because of the publicity we got, we had more than 1,500 opt-ins for the SMC alert in 72 hours. So that was such a win.
Terrific, thank you.
Anyone else? Miss Vadalos.
This sort of relates, but the fact that... Oh, thank you. I'm loud, though. The fact that we only have 12.8% of people on SMC alerts, I talk about it every day. Our city manager puts it out every week in the newsletter on social media, and still, we have 10% in my city, and I don't understand why people aren't doing it. It's a no-brainer to me.
Some individuals don't want to opt in because they're concerned about what we will do with their information. Some people are concerned that we will provide the information to other entities, which we won't. Some people just think it's never going to happen to them. With the national average being around 7% for opt-in systems, and now the national average for reverse 911 based on POTS copper line systems being about 35–40% of residences, we have to keep going forward. And our best data is always going to be those opt-ins because they're going to give us more ways to reach them. But getting that information from other sources, the more sources, the better. If we get 5 different sources that say this is the phone number to reach this house, we got pretty good confidence that we can call that house and let them know the fire's coming their way or the hazmat, they need to stay inside. The more data, the better.
I just want to make a brief comment. First of all, just thank you for, I think you drove all the way down to Santa Barbara early morning, but really representing the county and really sort of engaging the senator's office. I've talked with the senator and was very, very appreciative of your testimony. People think that this is easy to do. It's very complex, technology-wise, implementation and how you do that, finding the right sources. But just really thank you for being there. Thank you for really putting up an effort. And I think there's going to be potentially more bills to address this. So we're beginning. Hopefully, we can scale so it's not 12%, but it's 60 or 70 or 80%. And if we do that, it truly makes our community safer because if the right information is put out to them, they can react in a timely manner and know what the appropriate options are. So thank you very much.
Thank you very kindly.
That brings us to item 4, OES calendar, real quick.
Very quick. I have 2 items just to share with you. The first one, bottom right corner, Mavericks, the world surfing competition that comes to the coast. For the coast, we're in the window till the end of March as far as this event occurring. We do have a group that's set up within 48 to 72 hours notification, and essentially our first responder agencies, this is old hat. It's been a couple years since the event, but just as a heads up with regards to the first quarter for OES. And the second one is BayX. Now this one itself, we are an invitee to this one. This is the 95th Civil Support Team under the National Guard, and essentially we're very proud of this one. We're one of 5 sites that was chosen for a full-scale exercise, a CBRN exercise, chemical, biological, radiological, nuclear. This is the bad stuff. This is basically the Guard coming. Simulation is a white powder substance, taking out individuals on the BART. First responders arriving, our hazmat teams will be there working with the civil support team. Again, one of 5 sites chosen throughout the county, and this is really due to a partnership that we've had with the civil support team to be honored. Again, it's their party. We have limited, if any, invites and can report out at the next meeting as far as how it went.
Great, thank you very much. That brings us to a hazmat update.
And with that, Supervisor and members, I do apologize. We have another work event to attend.
Okay,
To the
great.
committee itself, with regards to the formation, I will be working with all of you on that one.
Great, thank you, Mr. Rose.
That was a good segue. Chair Canepa and members, thanks for having us. My name is Kent Thrasher. I'm a deputy fire chief with the newly formed San Mateo Consolidated Fire Department. Very happy to announce that. And we'll talk a little bit about how that ties into our hazmat team in a few minutes. I brought with me Battalion Chief Jeff Thorne, who runs the operations and training for our county hazmat team. So I just want to give you a brief update on where we are, some things that are in the works and changes for us, and where we plan on being in the very near future. So as you know, the hazmat team here, for the new members especially, we work under contract with the county to provide hazardous materials response services. We work in conjunction with the Office of Environmental Health. Wayman Wong's back here with us. Together we provide the response and show up as a team for any hazmat incident from the Bay to the ocean, from Santa Clara County up to San Francisco. We're a type team. We're part of a statewide mutual aid system. We're considered what's called a type 2 team. There's a lot of stats up there, but in the nature of time, we'll get through a lot of them. Again, this program started in Belmont, a very small town that started this decades ago because of a call that went very bad that involved hazardous materials before we called it hazmat. It killed some folks, killed some firefighters, and left some other ones in really bad shape and ended their career very early. As a result of that, the Belmont folks became very invested in hazards of chemicals and became very knowledgeable in it. And whenever there'd be a call in the county about chemicals or hazardous materials, they would call Belmont and ask for some advice or support. That evolved over time into the team. As recognition came in and certification started to come from the state and federal level, Belmont got on board, and we've been providing this service for several decades through a collaboration with the county and actually doing it through a fee-for-service contract for the last couple decades. And we take great pride in what we do. We cover quite a few areas. He mentioned Seaburn. We do all of that. We go down to the Slack Leonard Accelerator down in Stanford, up to the airport. All areas of the county are covered. Things that wash up on our shores, things that roll over in vehicles, things on rail cars, you name it, we'll take care of it. If you consider it a hazmat, we're going to come to take care of it. So it's a very broad scope of what we do. One of the big areas that we're looking at in this county that's changing is labs. We have a lot of biopharmaceutical companies here. They are growing rapidly, which is spectacular for our county. But as they grow, they're giving us some very creative challenges. One of the big challenges we're having right now is multiple level laboratories. So we used to go to laboratories that are on the ground floor. We have lots of resources that we have to get in there in very cumbersome suits. And now they're 5, 10, 12 stories in the air. It changes things for us. So we'll be doing a lot of training, a lot of collaboration with our local fire agencies, with the hazmat team for that type of thing. So just some photos showing you where we're at. We're down in Belmont. The vehicles that we use, the bulk of them, this is our primary response vehicle, is provided by the county. The county received this vehicle 2011. Jeff actually spec'd this vehicle out and made the purchase. Got a great deal on it. It's a phenomenal vehicle. We have hazmat teams from all over the Bay Area come and tour it before they order their new vehicles to see all the great things that we have on it to make sure they get put into theirs. I'll let Jeff talk quickly about some of the training we do, which is what you're seeing here, some of these.
Yeah, as you can see, one thing that's unique about our hazmat team is we're a non-dedicated hazmat team, which means by day job, we're firefighters. And then if a hazmat call comes in, we get off the fire engine and we get on the big giant red box and we go to the hazmat call instead. A lot of our neighboring teams around us in the Bay Area, Santa Clara County, San Jose, San Francisco, and so forth, they're actually dedicated teams. It means they have hazmat team members that are staffed that team 24 hours a day, 7 days a week. But we're held to the same level of training and accountability that those dedicated teams are by being a cross-staff team, as we call it. Each firefighter we have on our hazmat team has received well over 1,000 hours of training and ongoing training to maintain proficiency in running hazmat. Because there's almost 20,000 chemicals that are transported on our roadways every day. Just look up down 101 and see the big truck and kind of drive away from it if you can. You know, because it's amazing what's out there. So we got to be really proficient what we're going to. Because again, it's one of those things we call as a high risk, low frequency event. It means we don't go on a lot of them, but when we go on a lot of them, we're really, our height level is way up here in how we go to deal with these incidents. And it doesn't take much to turn on the news and see how our mission is changing as the fire service, but what's going on in the world and also in the United States involving chemical, biological, radiological, and nuclear weapons that are possibly out there. Because as a hazmat team, if we have something in the Bay Area, we're the ones that go out and help mitigate and stabilize the incident so it doesn't get any worse. And being a state resource, we're also go to mutual aid to other jurisdictions in our Bay Area as well. San Francisco needs help, we'll go up there. Alameda, Santa Clara, LA, doesn't matter. If they call for help, we'll go. And same thing, if we need help here, they'll come in and help here us as well too. So some of the pictures you see up there, some of those are actually some calls we ran on over the past 12 months. And a lot of them involve training too. The one in the middle is one we did over the San Mateo County Event Center. It's one we involved with the Terrorism Counter Assault Team, or the TCAT teams of the Sheriff's Office, which are cops in hazmat suits. And they go in, they neutralize or kind of take care of the bad guy, but we come as a hazmat team to clean up the mess that he left behind. And that red suit he's wearing is something called a level A suit. These are the big giant moon suits you see all the time. And these are actually require a substantial amount of training just to maintain proficiency in these. Because lack of a time, not painting too clear of a picture on it, is if we run out of air inside that suit, we'll suffocate inside the suit. Not to mention what's outside the suit as well too. So these are one of the things we have to require training on annually and several times during the year to maintain proficiency on it. We also do a lot of training with the firefighters in our county. Because again, they're our help with our responding on this. So we help them learning the basic how to stabilize an incident until we get there. Because it doesn't take much to drive around this county and see how long it takes to drive from Belmont to anywhere else in the county. It can take anywhere from 10 minutes to an hour and a half. So we rely a lot on the local fire jurisdictions from Daly City to Menlo Park to help get things started for us by the time we get up there. And we start this from the moment they get started in the fire academy when they're brand new hired, all the way up to 30, 40-year veterans are constantly getting training every year, and we provide that training for this county and also neighboring counties as well too. Jeff? Getting to some more pictures, you know. Again, some calls with the fire academy. The one up in the upper right-hand corner, that's if we have like somebody that's been exposed to a chemical, but there's a lot of people. Like we have an event that happens at Oracle or one of these large high-density places. Well, we have to get them clean very quickly, so strip them down, we run them through water. Very simple to it. It's not a fun experience to do it, but all our new fire crews get to go experience it because it's, you know, it's a rite of passage for them so much. So, go ahead. And again, just more pictures as training the fire academy, calls from Pacifica to Menlo Park. Again, we deal with everything. It's a lot more than just the unknown bucket on the side of the road or a truck that's overturned. It's everything else in between that we have to deal with. Because once they find it, we have to take care of it until it's disposed of. So, that's up to you.
So what lies ahead? So I mentioned earlier the new fire agency in the county, San Mateo Consolidated Fire Department. That's going to affect the agreement that we have with this organization. So the agreement right now is with Belmont. Belmont Fire Protection District has a contract with the county. That contract is a 3-year contract and it expires on June 30th of this year. So I'm currently working with Captain Denton, and we'll be presenting to you what our recommended contract will look like in April for the next term. We don't anticipate any large increases in it. We will stay around the inflation rate. I think I'm looking at somewhere around 4 to 4.5% per year on that. We are going to use the economy of scale to really help us out. The benefit of our new fire agency is we are taking Belmont, which has a total of 22 members, and it's 22 hazmat team members. That's the max we have. That's all the members they have in the city of Belmont for the fire department. And now we've incorporated that into our larger organization. We have 130 plus firefighters there that we can use on the team. And we're going to increase the number of our team from 22 to 30. So we are going to go from having 6 or 7 hazmaters on duty every day in this county to having 10. It's just going to give us much greater availability, much better flexibility Like I said, we're a regional team. We find it very difficult to send folks out of our county to train and play with the teams around the area because we just can't spare to leave them from their fire department jobs and send them off. This gives us the flexibility to do that. But we think due to the economy of scale, we can do that and keep the cost basically flat at where it's at. So we look real forward to doing that. We look forward to bringing in some members from what was the Foster City and the San Mateo fire departments who already have the basic training needed and bring them into the team. Good. So we talked about the organizational changes already. Go ahead, Jeff. The impacts to the hazmat materials response model. We don't really see much in the way of change between now and the end of the contract. We're going to stay status quo. We have still the same number of members that are able to respond at 22, and we don't see a lot of change in the way the response model is going now. After that, when we jump into the new contract and we're able to bring in those new members, we do see some changes. We think it can get bigger. We're looking at the models right now. We used to have it where if a hazmat call came in, the hazmat team went out. We would show up and it was a 5-gallon bucket of milk. It was not a bad chemical, and when we go home. Now we do a process called a hazmat consult where the local fire jurisdictions go out. They say, it looks like milk, we're not really sure. We get on the phone with them, walk them through that process. We don't go to the expense of sending that big hazmat response out there and the call's taken care of. That's done a lot of good for us. It's reduced the number of calls we do on an annual basis, saved all of the agencies in the county a lot of money. And we want to continue that trend. So we want to do a few more tiers of hazmat type responses, and you'll see that happen as we are able to increase the size of our team. Go ahead, Jeff. And we just talked about the plans moving forward. We don't need to get deeper into that. And with that, I'll close it out and I'll offer up to answer any questions anybody might have.
So I guess, thank you for that. That was really helpful. I guess what you talked about, more biotech coming in. I mean, we have more coming in San Carlos. How do you find yourself ability with all the traffic and other issues to maintain sort of the service level if you've got either multiple events or you have to get to South City, which could take some time at 4 o'clock or 5 o'clock and getting in there. Do you have enough from the equipment side as well to kind of meet that if you have multiple events as well? It sounds like you're ramping up on the personnel side, which is great, but from the equipment side,
right.
I'm curious to hear about that.
I'll answer it a couple different ways. One is I'll tell you that this year we're just under 30 calls for service this year. So we're not a hazmat team that runs hundreds of calls a year. And Jeff mentioned that we're not a dedicated team in that we don't have hazmaters just sitting around waiting for hazmaters like a San Jose, San Francisco, Santa Clara County. They're very large agencies. They can absorb that kind of thing. So we don't do it that way, and that's why. One is the size of our organizations. The other one is the number of calls we have. It just is year over year. We're in that 20 to 30 calls for service a year range. We don't see the justification for upping that up or maybe putting another unit to a deeper part of the county. The other part of it is all of our fire department counterparts in the county, 55 fire engines basically, they're all trained at a certain level for hazmat response. They're at a FRO level at a minimum, and some of them have the same level of training that we have. So they are able to get to a scene, start the evacuation process if needed, and then the big thing we do with them is they isolate the issue and deny entry. Keep the problem from getting any worse. And then we get on the phone with them as we're driving there and we work through what they have in front of them, what we can do to help them out, and we get there as quick as we can. They're a big part of our response. So those local jurisdictions, we show up with 7 players, and they're going to inject another 15 to 20 players that play support roles. So we do it because it's a collaborative effort with the whole county. We look at our team as being part of the whole county's fire department. So I don't see the team changing much, the number of vehicles changing. We respond from Belmont right now with that big hazmat vehicle you saw. We have another bobtail that we got through a grant with the county a couple years ago that goes, and then a fire engine or 2. We show up and see what we have and put the team together. It's a big event, and they're usually 2.5 to 4 hour calls. So they're very, very labor intensive. Hope that answered your question.
Yeah, great, thank you.
Yeah.
Questions? Mr. Sylvester.
I just wanted to make a comment, if I may.
Yes, sir.
First of all, I'd like to thank you and your team for what you do. a few years ago, I actually put on one of them hazmat suits. And you are absolutely correct. It's tough to breathe in. It's tough to see out of, and you perspire. And I thought of the words that Clint Eastwood says, a man's got to know his limitations. And I'll tell you, I wouldn't want to be, basically have to be called upon to wear one of those suits. But you also made something, a mention about something on the roadway, so I just wanted to leave this with my colleagues. According to the California Vehicle Code, there's actually 2 items that you can throw onto the roadway. 2 items only, so you guys probably already know that, but I'll leave that with the rest of my colleagues, and one day I'll tell you. Thank you very much.
We respond to those too, by the way. Yes, we do.
Are there any other additional questions? And I'm assuming when you come back on the 18th, will there be a budgetary request?
Yes, I believe it will be. I'll be working with the crew, Captain Denton and his staff, to get that prepared for you and have something ready for you.
All right, thank you very much.
Thank you very much.
That brings us to item 6, Emergency Managers Association update. Hey, Ken, Mr. Anderson.
Good evening, Supervisor, council members. Happy New Year. Hey, Happy New Year. Yeah, what a busy New Year it's already been, huh? A couple earthquakes and some severe weather to get the disaster preparedness juices flowing. I'm here to give you a quick briefing on what our association is going to be working on the first couple months of the year. And a couple of those are, as you saw the survey, we see where our gaps are. So some of those are at our meetings, which happen every 4th Thursday of the month in the Belmont EOC. We're going to be collaborating on with the National Weather Service, environmental health. We're going to invite some private agencies, private businesses, Genentech. Cal Volunteers is going to come and talk everything CERT. We have a specialist coming to talk to us about donations management, as that was number 1 or 2 of our gaps there. And then we have a special presentation that we're putting on March 6th at the Belmont Recreation Building there. We're going to have debris management and post-disaster workshop. So we're getting in the flavor of the month in disaster management and debris management, and we're going to have our who should attend: emergency managers, first responders, building officials, park and rec staff, public works, EOC staff, and financial staff. So it's going to be broken up through the day, through the workshop, all those different flavors, and we're going to learn a little bit about debris management in the upcoming months. That's it. Thank you.
Chair.
Mr. Sylvester.
I just lost it. Anyway, just an update. There's a armed individual at the Ampex in Redwood City, and the police are holding him at gunpoint. But anyway, sir, for your presentation, thank you for your presentation. I'm wondering if there's any openings like for citizens. I know in Daly City, the son of a fire chief is an excellent meteorologist, and that appears to be his thing. And if we can get more folks involved to help provide information and expertise. I think he's only 15, 16 years old, Deputy Chief Maffei's son, and he's even published a book. So I just wanted to put that out there. Thank you.
Ms. Schneider.
My city manager mentioned to me the Conservation Corps, California Conservation Corps, may be getting more funding from the state. When I was doing disaster cleanup after Loma Prieta, they were a huge part of our cleanup in San Jose and in the hills. Are we incorporating them into the invitation? We can. Absolutely. Just an idea, and if there's money there, that I always like to keep an eye on money. Good group to work with. They were hugely instrumental in cleaning up after the Loma Prieta up in the hills around the epicenter and all the way through San Jose. They do a lot of things at wildland fires as well. Yeah.
All right. That brings us to item 6, the American Red Cross update. I see we have a couple representatives. The red was a good tell.
Right? I did not plan it that way. It's just raining, so it's my rain jacket. Well, good evening and Happy New Year, Emergency Services Council members. Hi.
Lots of familiar faces, sorry. I have not been here for about 5 years now. I used to come here regularly. I used to be a regular resident of this meeting. My name is Olga Crow, and I am a stand-in disaster program manager for San Mateo County until we find the replacement for Go Funai. Most of you probably remember him still. He took on an interim position with our services to the Armed Forces and International Services at the end of October. It was supposed to be interim, but he loved it, and so he accepted the offer, and he is now a full-term Director of Services to the Armed Forces and International Services. So if that's ever a topic, we'll bring him back. I'll be happy to have him here. Otherwise, I am the title is Senior DPM, or Senior Disaster Program Manager for the Southern Territory of our region, which, as you may recall, spans from Oregon border to San Luis Obispo. So I cover San Francisco to SLO. Anyway, I may or may not be here in April, so I'm going to take this opportunity to tell you a few things that we've done in the last quarter, which still thanks to GoFunai and the fantastic team of volunteers in San Mateo County. In the last quarter, we've had a total of 15 responses, so that's fire or police or any other responding agency called us up, told us they're displaced residents, so that happened 15 times. That equals to 51 total of displaced residents in the last quarter. 41 of them were adults and 10 were children. Our average response time in San Mateo County is 1 hour and 4 minutes. It's very precise. I don't know how it comes up with that. And what that means is 90 to 97% of our workforce are volunteers throughout the nation. And in San Mateo County right now, it's pretty much 100% because I'm the only one and I'm a stand-in and I still have the other job to do. So 100% of work in San Mateo County is performed by volunteers throughout the county. So 1 hour and 4 minutes, that means you call us, we pick up the phone, usually it's in the middle of the night, they wake up other people, get in the car, and drive anywhere in the county because we're not geographic. So it's fantastic. Our nationwide goal is 2 hours, so we're well within the goal there. For your interest, let's see, Daly City is here. We had 2 incidents in Daly City. We had 1 incident in Colma, 1 in Brisbane. I believe Colma resulted in fatality. That was a very difficult response, I know, for the city and for our team. They're still working with the family. We had 1 in Brisbane, 2 in Redwood City, 2 in San Mateo, 2 in South San Francisco, 1 in Menlo Park, 1 in San Bruno, Moss Beach, Hillsborough, and East Palo Alto, respectively, 1 each. So as you can see, that was a busy quarter. San Mateo is not the busiest county as far as responses, thank goodness, but that was pretty busy. Among other things that we did last quarter in San Mateo County is, you may be familiar with our Sound the Alarm program, Sound the Alarm Save a Life. That's when we go and install free smoke alarms to any resident in San Mateo County. We also educate them on fire preparedness or fire prevention and general preparedness. So we had installed in the last quarter 187, or installed and prepared 187 households in San Mateo County. And we're doing that pretty much regularly through our appointment-based system, but we also hold events every few months or sometimes every month, depending on the demand. Our last event was throughout San Mateo County. We just sent out the teams to various different cities and they installed alarms. We also do pillowcase presentations. Hopefully all of you are familiar with the program that's designed for 3rd and 5th graders. There's going to be an ask coming up with that. Our goal, so when we prepare adults, we hope they pass it on to children. Sometimes they do, sometimes they don't, depending on the family composition and the time that the family has. So understanding that not all families speak to each other about preparedness all day long or even once a week, we also try and get children to be prepared on their own in hopes that they go back home and talk to their parents about it. And for that purpose, we partnered with Disney, and they've designed pillowcases for us. And the reason why it's pillowcase, because during Katrina, people were running out of the houses and they were grabbing pillowcases, the only quote unquote suitcase that they could very quickly put things in, right? Easy to carry, usually pretty durable. So Disney designed fantastic pillowcases for us, and we've introduced this program some years ago to third and fifth graders, or third through fifth graders, and we teach them preparedness. They design the pillowcase, they write and draw what they're going to put in it. Ideally, they take it home. It's a big pillowcase, it's bigger than any pillow you have. But anyway, they go home, they put stuff in it, hopefully talk to their parents, frame the pillowcase. I don't know what they do with it. Ideally, they talk to it about with the family, right? So we have a goal in San Mateo County to prepare 300 youths. We're kind of reintroducing the program here. We so far done 91 in Daly City, so thank you very much for participation. And the ask is we need more. We don't need to stop at 300. If you bring us 1,000, we'll take 1,000. It's a very valuable resource. Statistics prove that children do take stuff home. Statistics prove that children do talk to their parents. And statistics do prove the parents get excited about things their children are excited about, if for no other reason, just to be excited for the sake of children, right? So please help us with getting to third and fifth graders in your respective cities. If you have a third or fifth grader, that's probably easier. If you don't, if you can talk to schools about it and or schools in your jurisdictions and have them contact us, we will be. Huh? Oh, sorry, I thought you had a question. And we'll be happy to come and do the presentation. Presentation is 45 minutes to an hour. We also prepared, through our general community disaster education, we prepared 600 people in this county so far. By that I mean 600 people were given 3 steps to preparedness, and we had a conversation about it. So it wasn't a community event, here's the brochure, thank you, bye. We've had a lot of those too. I'm talking about actual education on preparedness. One other ask we have, and it's also part of our ongoing efforts, is to survey potential shelters. Obviously, a lot of conversations here is about disaster preparedness. Having available sites that are ready to go, that know what we're going to use them for, they're going to respond to all of our community in the middle of the night is very important. Again, looking to you as your city commanders to help us gain access to locations that you think are going to be the best shelter locations in your jurisdictions. We tend to go for schools, large churches, or large community-based organizations that have a building or a space. But you know your city better than we do. You know which building may or may not survive. You know which building is the best location, best access, so forth. Please help us with that goal. Our annual goal this year, this fiscal year, is 30 shelter sites resurveyed. So we've probably already surveyed all the cities along the line. But we would like to survey 30 this year. We've already done 10. So 20 would be great. Or 50. So that's all for my report.
Are there any questions for Olga? Yes, Ms. Borgens.
Can we have a contact information if we want to reach out to our schools? What do we tell them? I just don't want to say Red Cross, so if you have.
Yes, absolutely. I have a bunch of business cards.
Perfect.
Should I pass?
Would you give them to the clerk?
Thank you.
Thanks. Yes, Ms. Schneider.
Are we still going to have an update of our cities on today's agenda? I know it's a long meeting.
That does not appear on the agenda, but we can make sure that it's on the next agenda. You're referring to?
There's time. I'm sorry.
So,
Hi, thanks, Olga. Olga was my boss when I was a Red Cross volunteer, so it's lovely. And she was the lead when the San Bruno gas explosion. So it's really lovely to see you back. You were a great person to work under. Millbrae is having, it started as a bike rodeo. It's now going to be our big safety event on May 11th. And I will reach out to you. But we're inviting all of the safety entities. We've just brought the fire department in. The sheriff is with us 100%. I will go find you some third and fifth graders. So lovely to have you back.
Thank you.
Even if it's short term.
Hey, you never know how long it takes us to find a suitable candidate. Any other questions?
Are there any other questions? There are none. Thank you very much. That brings us to item 7, public comment. Okay, long line. Moving forward, that brings us to item 8. Are there any announcements? First of all, I want to congratulate Adam Rack for being elected to the San Carlos city council and welcome him to the board. So Adam, it's great to see you. Can I get a motion to adjourn? All those in favor? Our next meeting is April 18th, 2019. Thank you very much. I know.